Yeah, sure. Have you got many that are waiting for beds?
The pace is relentless.
Jared, how are we doing on inbound ambulances?
Dr. Sutherland and her emergency team at King's College Hospital must constantly be prepared for the unexpected.
Who came through here?
We had a transfer.
Right, with
A brain bleed, a subarachnoid.
with a subarachnoid hemorrhage. Okay, obviously.
Exhausted, frustrated, and they're losing staff.
There hasn't been a downtime. There hasn't been a rest. I mean, we're incredibly lucky here. We've got a really strong team spirit, but there's no doubt we're losing staff because it is relentlessly busy.
The winter is unlikely to bring respite, with warnings over a so-called twindemic. That's COVID and flu.
We still have patients who either have another disease but have COVID also, and we still have some patients who are directly affected by COVID.
So is the pandemic over as far as you're concerned?
The pandemic isn't over, but like everyone else, we're learning to live with COVID as one of the respiratory viruses that we treat.
1 in 8 people in England are waiting for operations or other types of care. This trust performs around 150 surgeries every day to try and cut through the backlog. While the government has made the waiting list a priority, the workforce wants more support.
One of the things that we'd really like to see is national investment in National Health Service staff. So more doctors, more nurses, because those are really the engines of treating patients. And in terms of disease prevention and investigation, obviously those things are massively important as well.
Staffing pressures aren't restricted to hospitals.
Some 1 in 7 patients are in a hospital bed when they should be at home getting better, but there isn't any social care provision for them and it isn't safe. So the Prime Minister's decision to prioritise social care is being seen as a positive step.
Trust leaders accept they need to find a way to do more with the resources they already have.
We need to be more efficient and we need to be more productive. And of course, one of the key issues that we need to make sure there's adequate flow out of hospitals into social care so that we've got that flow all the way through a hospital. We think now this is not so much a hospital problem, this is a system issue.
The health service has already faced the equivalent of winter pressures this year. So there will be no let up as it braces itself for the real thing. Ashish Joshi, Sky News at the King's College Hospital in London.